10, 20 years ago.
You would be surprised at what they wanted to do. Like trying, whatever, it's a cigarette.
That are in the later stage.
I just want to read a disclosure that we have for today. According to the ANCC-COA criteria, there is no commercial support for this continuing education offering. The speaker has no conflict of interest as presenter of this class. The speaker will not be discussing off-label use of drugs or equipment. And finally, to receive continuing education credit, the participant must attend full educational offerings. So I wanted to read that, and we got that taken care of while we're miking up Dr. Marion Evans-Lee. And we're ready.
Okay. Good morning. You know, sometimes when you're at work and you try to leave a little bit early, I tried to leave work yesterday about 3:30, but something wouldn't let me go. And at 4:27, my phone rang, and it was Linda Conley asking me to present this morning. I told her, I said, my purse is already in the car. So, but when you have good people in the work that they do at Future Builders, you have a hard time saying no. So please bear with me. I know some of you may have heard this presentation before, but we're going to talk about racial disparities and tobacco use. Just a few things we're going to cover. We're going to kind of do just to give a thoughtful assessment of some things in the room. I have a few questions that I want to propose to you. We'll define disparities. We'll look at some tobacco statistics. We'll also define disparities as it relates to tobacco use. And I saw a lot of people outside when I pulled up. So you may be hearing from me on our next break. Okay. And also some plausible causes of tobacco-related health disparities, the why, and what we can eliminate and what we can do to eliminate those disparities. So just take a moment and reflect. Do you deserve everything you have? Are you entitled to live in a safe community? What would happen if you couldn't go to the doctor when you were sick? Have you ever felt like you were at an unfair disadvantage? Is the statement, all men are created equal, a reality in the United States? So I just want you to take a little bit and reflect on that. So what is disparities? Well, disparities is a great difference. There are a lot of disparities that exist. However, today I'm only going to touch on a few of those disparities. It's the condition or fact of being unequal as in age, rank, or degree, a simple difference. So we'll talk about, for the purpose of this presentation, disparities in healthcare, in health, and in geography. And you can also think about some other disparities that may exist. So the National Library of Medicine defines healthcare disparities as, refers to it as the difference in access to or availability of facilities and services. Think about the community in which you live. Think about the healthcare facilities in that community. How many are there? Are there any at all? Defining disparities in health, a type of difference in health that is closely linked with social or economic disadvantage. I know Senator Chesterfield touched on it a little bit earlier, but I know you will hear some astonishing facts today about the percentage of minorities in the United States versus the percentage of the population who actually have HIV and AIDS cases in the United States. And there is a disparity that exists. What's that, a song? Did you know that just by where you live can determine how long you live? How many of you have ever heard of the Red County Report? Well, it was a report that was commissioned by a state legislator, and they looked at the disparities in the life expectancy among the counties in the state of Arkansas. For example, in Benton County, that's northwest Arkansas, where you have your Fayetteville, Rogers, that area. In 2008, the life expectancy was 79.8. In Phillips County, which is Helena and West Helena, the life expectancy is 69.8. In the Delta, there's a 10-year difference just by where you live. Now let's look at, before we get into tobacco-related health disparities, let's look at a few statistics. 47,000 African Americans die each year from smoking-related diseases. LGBT have roughly a 40 to 70% higher smoking rate than those that are not. And the individuals who work in LGBT-oriented nightclubs are disproportionately exposed to secondhand smoke. Now, these statistics are not specific to Arkansas, but Hispanic males and Latina females were less likely to be covered by workplace smoking policies. And this is national. Let's look at tobacco-related health disparities, healthcare disparities. Minority patients are less likely than whites to receive smoking cessation advice. There are some factors that may be associated with this particular disparity. For example, have you ever considered our older, or I should say more seasoned individuals, and they may refuse treatment from an African-American physician because they don't feel the African-American physicians receive the same training as white physicians. That creates a disparity. Or the lack of interpretive services. There's nothing like not being able to communicate with someone when you're in pain, when you're hurting. Higher smoking prevalence rates among minorities increases the risk of lung cancer. The differences in smoking prevalence, metabolism of tobacco smoke products, and susceptibility, all of which create a disparity regarding those diagnosed with lung cancer. It also goes back to disparities in healthcare and care as well. Let's look at tobacco-related disparities regarding race and ethnicity. Among African Americans, the incidence of lung cancer is 76.1 per 100,000. Look at the rest of the population groups and the incidence of lung cancer. Now let's look at lung cancer as it relates to geography. 76 per 100,000 in the South. Your chances of developing lung cancer increases. So look at this. For an African American male smoker living in the South who has limited access to health care, and the health care that he does have access to, no one ever talks to him about quitting tobacco, what is the probability that he will have a prognosis of lung cancer? And I tell this story because I just thought, in my position, in what I do, that all the physicians are supposed to do the right thing. But it wasn't until this year that my doctor ever asked me what I did for a living. And then in our conversation, I found out that he wrote the cessation program for the hospital there in Pine Bluff. He knew I didn't smoke, but he never had an opportunity to talk with me and found out what I did for a living. So imagine someone in a rural community who has that limited access and then not even ever being asked a question if they smoke and if they were ever considered cessation. So why is this the case? These are some of my plausible causes, or my theory. In 2011, cigarette companies spent $8.37 billion, that's billion with a B, on advertising and promotional expenses. Now, I'm focusing heavily on African Americans, but know that the same is true for other disparate population groups. It's not just race and ethnicity. It's the advertising. Youth are exposed to 500 559 tobacco ads. Every adult female, 617, but African-American adults, 892 ads telling you to smoke. Encouraging you. The tobacco industry, they're clever. They're not just going to come out and say, hey, smoke our brand. No, they do things like they name cigarettes after things that have meaning to individuals, like the Hispanic and American Indian population. They named the product Rio, Dorado, American Spirit. Or they also have bar promotions and sponsorship and advertisements in specific publications, in your magazines that you read. Think about your Ebony's, your Essence, your Jets. Now let's look at these photographs. The upper left-hand corner is an LGBT magazine, The Advocate. Look what this individual is doing on the cover. There's no specific brand, but there is the incident of smoking. Here's a Spanish ad. Look at the equal sign on the tobacco on the cigarette box. Stamp of approval. That's letting the LGBT community know, hey, we're okay with your lifestyle. Here, smoke this brand. Everybody's treated equal. Everybody has an equal opportunity to die. And now we're seeing more and more of why quit, switch to blue, the e-cigarette. More and more of these advertisements. This is a direct mail promotion. Who would not want a 2014 Ford Mustang? Now, I found this in the little grocery store that's across from our office, across the parking lot from our office. And this is a recent campaign. If you hit it one more time, Ruthie. And the campaign ended on October 31st, 2013. But these kind of campaigns, they use the urban culture and language to promote menthol cigarettes, tobacco-sponsored hip-hop bar nights with samples of specialty menthol cigarettes, you know, the grape, targeted direct mail promotions such as the Newport Wheel of Pleasure. So you can win a 2014 Mustang, and then it probably will be in orange and green. Expenditures for magazine advertising of mentholated cigarettes, popular with African Americans, increased from 13% of total ad expenditures in 1998 to 49% in 2005. The more they advertise, hit it one more time. Look at this disparity in menthol cigarette use. This is from SAMHSA. Look at the top line that was circled. That's African Americans and their menthol cigarette use. That's where they are on that scale. Now, one more time for me. This is the percentage of African Americans who smoke non-mentholated cigarettes. I think there's a link here with the advertising and the product use. If I ask a simple question, what brand is preferred by most African Americans, what would you say? I rest my case. And Newport is a menthol-based cigarette. And menthol, it covers up the harsh taste. You know, after so long, your senses kind of dull to it. And it's also considered a start ingredient which make it popular among young and beginner smokers. An individual who smokes a menthol-based cigarette can inhale longer. Remember when we talked about susceptibility and metabolism and the incidence of lung cancer? There's the link. So these are some people. I really wanted to get to this because I think this is just eye-opening. My administrative specialist and I went out one Friday morning to look at tobacco advertisements in Pine Bluff. Now, there's a lot of other advertising going on at this particular facility, this business, and it also poses a safety concern. You can't even see out the window. This zip code is 71603. One more. Go ahead. This is 71601. This is located on Dalloway Road, directly across from Dalloway High School. Dalloway High School. And at one point, when I used to go into this store, they used to have a sign no more than 2 students in the store at a time. But I'm pretty sure they took it down because they probably didn't see it with all the other advertising up on the board. So go ahead and bring up the arrow. There's the Newport sign. One more. Blue. And there were some more up there. And there were some smaller ones that you couldn't see. But again, this is 71601 Dalloway Road, directly across from the high school. Now this is Highway 270 or Sheridan Road, which is 71602. This is Whitehall, the store. This is across. There are several other gas stations in the area. There's a hotel. There's a McDonald's in this area. But look at the signage. You can go ahead to the next one. And one more, bring up the arrow. There was one lone e-cigarette sign sitting there. And we had to actually pull up to the window. We couldn't just sneak and take the picture. We had to actually pull up to the window to see it. This is 71603 Camden Road. This is not far from the Watson Chapel Junior High School. There's one sign in the window. Go ahead, Ruth. Right there. One sign. One more. Now this is Olive Street in Pine Bluff, 71603. This is across from Walmart, several other gas stations in the area. There was no signage in the window, but what I did notice, and I could not get a picture of it, was that there were Black and Mild strategically placed in the window behind the cash register. So then when you pulled up to the store, you saw the cigarettes sitting in the window, the Black and Mild cigars sitting in the window. Now, the reason why I had these two pictures side by side, because as you know, that anytime the road takes a major turn, it changes its name. Remember earlier I told you that was Dalloway Road. This is Camden Road. Well, it's the same road, just different zip codes. The same road. And look at the disparities that exist in the advertising. So when you return to your community, tell me if you notice a difference in advertising in the majority minority areas of your community. What can we do? We can include members of the specific population in planning and policy planning steps. We can monitor the impact of tobacco on specific population groups. We can establish cultural competency standards for statewide programs. We can fund community programs to help reduce tobacco-related disparities in specific populations like we do with Future Builders. We can integrate population-specific efforts into larger wellness tobacco campaigns. And we can disseminate findings and lessons learned. And I'm pausing here because I want to close with a short video of a very, very good counter-marketing strategy that was put together by a colleague that our program works with out of the Fenway Institute in Boston. And this was held on the, between the 8th National LGBTQ Health Equity Summit and the 2012 National Conference on Tobacco or Health. And I'm going to cue it up for you.
so fast. So it says tobacco free because big tobacco gives more to politicians that are against gay rights than those who would support us. So kind of a big deal. I mean, we want our rights, so then we should vote. With the varsity, and for us to be able to put so much positive messaging around the health of the community, especially as it relates to tobacco prevention and control, was phenomenal. As an LGBT health researcher, someone who's invested in tobacco cessation and control, this was an amazing, amazing piece. This is where the smoking happens. This is where it starts. This is where our people learn how to smoke. This is where our people have to learn how to stop smoking. Because, you know, it doesn't come out of a textbook. It comes out of real life and the people that they want to be like Pandora's box, telling them, do not smoke. I'm not going to make out with you if you smoke. And that's the way life really works. And we got to learn the lessons from the way it's happening.
The tobacco industry is really masterful at targeting our most vulnerable populations. And I think we've got to show them that all of those populations have what it takes to stop them and take care of our own and take care of each other.
A lot of times we just sit back and expect people to come to us. We got to work off hours, be in bars, be at other events.
Let's do work where we live, where we play, where we love. Let's create messaging around the spaces that are meaningful to us.
This is where the rubber really hits the road. This is where change happens because people see people they want to be like and they want to be with, having fun, telling them, baby, it's got to be tobacco free.
Smoke free and sexy with birds.
Okay. Thank you. Yeah. Uh-oh.
Allow about a minute for question and answers, and then also present the Future Builders Inc. Special Appreciation to Dr. Marion Evans-Lee and Lewis Henry on this 4th day of December 2013 for your excellent and informative presentation at the 9th Annual Arkansas HIV Tobacco Prevention and Awareness Symposium. Moving to the next level, integrated strategies to release the grip of HIV tobacco use within our community. Thank you for your great work in the battle to fight HIV and AIDS.